Hello, I'm Dr. Michael Ches. I'm a pediatric epileptologist who's here to talk to you today about perampanel, also known as Fycompa. I'm here talking about this medication to educate you about it on behalf of the LGS Foundation. Next slide, please. Fycompa is an anti-seizure medicine that acts on a receptor called the AMPA receptor, and that's used to block excitation from glutamate. That makes it unique among most of the common medications used for epilepsy, which don't typically work on that as their main effect. And because it being a unique mechanism, it may be a good medicine to add in to have a different type of effect when there are other mechanisms that aren't fully working, such as GABA or sodium channel or other types of GABA receptors that are used. It's very effective for partial seizures and for idiopathic generalized or secondary generalized epileptic conditions. So for convulsive, generalized, or secondary generalized seizures with tonic-clonic activity, this is a very effective medication in the experience so far. Next slide, please. They come as different sized tablets between 2 and 12 milligrams, and they're once a day. And the other nice thing about these is it also comes as a liquid. So it has options for patients to take as a liquid once a day or a tablet once a day. It's a once a day medication, which is nice for the patients. It also has a long half-life of 105 hours roughly, so that it lasts several days. So once you're at a steady state where you've taken the drug for 5 or more days, after a week or two, if you miss a dose by accident, the drug level stays fairly stable, so the chance of you having withdrawal seizure is less with a long-acting medication than a short-acting medication. That's one other advantage to this medication and the way it works. Next slide, please. Why would you decide to try this? If you have focal brain damage that caused your seizures with both focal and generalized epilepsy, and even if you involved into a developmental encephalopathy type of epilepsy or a Lennox-Gastaut type of epilepsy, if there's a focal dysplasia of the brain or injury to the brain, medicines like this may be very helpful for both partial seizures and convulsive seizures that may spread from those areas. For generalized tonic-clonic seizures, it's very effective. However, it's been found so far in experience in the clinical world since it's been released roughly slightly less than 10 years ago, that the atonic, tonic, or atypical drop attacks that we see with Lennox-Gastaut syndrome, for example, or absence seizures that are atypical or typical may not respond as well as the more convulsive generalized seizures. And it's possibly a good choice for adults who have outgrown their LGS and still have more focal or generalized convulsive seizures, but no longer have the tonic seizures. So for older adults with Lennox-Gastaut, this may be a very effective medicine if they have convulsive epilepsy. And it's very effective for generalized convulsive epilepsy. Next slide. Why would you be concerned about trying this? Like a lot of medications, there are side effects. One side effect is it can cause some irritability, but usually at doses that are higher than 8 to 12 milligrams a day. Many patients respond for convulsive epilepsy in doses as low as 2 to 4 milligrams a day, with good data at the 4 milligram for adults with epilepsy. You can also give the same dose to children from infancy on based on the dosage more than the weight, so that you can start someone on a 2 milligram dose even if they're a small child or an adult because of the way the drug has a long half-life and distributes in the body. So it's a different drug system that way. The black box warning is about causing anger and hostility in a small number of patients during the research trials. It did not get a black box warning in Europe for this, only in the United States. And there's a risk of it causing anger and aggressive behavior, even something called homicidality, with thoughts of killing other people in 5 or 6 patients out of thousands that were tested. Because of that, it got a black box warning. I will say, obviously, if someone's irritable and angry on the medicine, you would want to talk to your doctor about possibly stopping it. But we tell our patients up front about this, and in the real world, no one's ever gotten homicidal on this medicine. No one's ever gotten to that point. And although it causes irritability in a certain percentage of patients, it's usually at the higher dose. So if you're on it at a lower dose, it probably won't happen. And if it does, you can lower the dose and see if it goes away. The advantages are it's a new mechanism that's different than previous drugs we've used for epilepsy. in that it works on the AMPA receptor, which blocks glutamate. There's a long half-life. It makes rational addition if you're using mechanisms like GABA and sodium channel or calcium channel. This works in a different way, so you can add a new medicine without hitting the same mechanism that may not be working. And it might cause synergy between different types of drugs. And because it has a long half-life, it can be given once a day. And if you miss a dose, it's less likely to cause a withdrawal seizure. And we know by accident, sometimes people miss doses. Next slide, please. If you want more information, feel free to look at the Lennox-Gastaut Foundation website at lgsfoundation.org.